Welcome to the Vasek Polak Radiation Oncology Department at Providence, St. John's Health Center. Located at the garden level, our center provides comprehensive, state-of-the-art radiotherapy services by highly trained, board-certified physicians. In our community hospital setting, our care team offers an extensive level of care and ongoing support. We treat each patient as family with compassion throughout their treatment and recovery. There are several key individuals at our center who work together to provide the most comfortable treatment experience possible. The radiation oncologist specializes in the treatment of cancer by using radiation therapy. They develop patient treatment plans and work with other staff to ensure quality care. With almost 30 years' experience, Dr. Robert Wollman specializes in advanced radiation techniques, including image-guided radiation therapy, IGRT, stereotactic radiosurgery, SRS, stereotactic body radiation therapy, SBRT, accelerated partial breast irradiation, APBI, and intraoperative radiation therapy, IORT.
I'm Dr. Robert Wollman. I'm the Medical Director of the Vasek Polak Radiation Oncology Department at Providence St. John's Health Center. I've been the Medical Director of this department since 1998, and over all those years I've seen incredible growth of the cancer program in terms of the types of doctors that we have here and in types of the diseases that we treat here and the amount of technology that we have here. And that's really the beauty of Providence St. John's cancer program, that we have so many wonderful doctors in a relatively small space. And that gives us incredible opportunities to collaborate with one another on research programs, on innovative cancer treatments for our patients, on earlier and earlier detection, particularly now under the leadership of Dr. Gordon, who's a world-renowned expert in genetics and using genetic tests to find cancer earlier and earlier. As we find it earlier, we can cure it more effectively with fewer side effects.
The radiation oncologist also works with other physicians collaboratively to ensure the best possible outcomes.
So hello, my name is Dr. Vasek. I'm a radiation oncologist at St. John's. We have a really special opportunity to interact with a lot of the multiple disciplinary tumor boards and other providers. With this community-based feel and a small department where we're able to actually talk to all of our providers in person, we can provide a lot of personalized care for our patients.
The radiation oncology nurse also specializes in oncology and will help coordinate your care with the physicians and other staff. The nurse is available to help you with your day-to-day concerns, help you manage side effects, and can refer you to other healthcare professionals as needed. Many of them are certified by the Oncology Nursing Certification Corporation.
We're here to support you through the whole process, help you manage your symptoms. Say if you're having some skin changes, okay? So first of all, we teach you how to prevent that, how to keep your skin in good shape, with nutrition, with skin care, that type of thing. And then we also do referrals. So say like you needed a nutritional referral, maybe you're having trouble swallowing. We have a fantastic nutritional department that has classes and we can make special appointments for you for personal nutritional counseling as well. We have social services. So we're a huge, all-inclusive kind of team. There's lots here that will support you through this. Okay, you're not alone.
The radiation physicist holds a PhD or master's degree in medical physics and may be certified by the American Board of Radiology or the American Board of Medical Physics. The physicist is responsible for the measurements and doses involved in radiation therapy and other related calculations, ensuring a high degree of safety for all patients treated at our center. The dosimetrist is certified by the Medical Dosimetrist Certification Board and appreciates the radiation treatment process and equipment. They work closely with a medical physicist and radiation oncologist and ensure the accurate delivery of the prescribed dose of radiation while documenting pertinent information, verifying the mathematical accuracy of all calculations. The radiation therapist is trained and certified in radiation therapy by the American Registry of Radiological Technologists, ARRT. Under the direction of the radiation oncologist, the therapists are responsible for delivering the prescribed treatment. They interact with the patient daily and ensure that the treatment experience is pleasant and worry-free. During treatment, the therapist helps the physician use CT scans and other imaging methods to localize the treatment area.
My role as a radiation therapist is to make sure that we get an accurate, precise treatment to the patient, but also one of our jobs is patient care. We try to take the time to make sure the patient understands what we're doing for the treatment. A patient that understands is much more cooperative, and a cooperative patient usually means a better treatment. We take an image while they're on the table in the setup position, and we look at it on our screen so that we can make sure that the target is pinpointed perfectly before we do the treatment. There are certain treatments where we will even get the doctor to come over with us, and then we will all look at the image, confirm that it is correct before we do the treatment, making sure that it's exactly where we want it to be. You know, we see the patients every day, so the nurses and the doctors will rely on us if we notice a problem with the patient's condition, how they're feeling, and our responsibility is also then to relay that information to the nurse or the doctor so that they can follow up on it with the patient. We get to know them pretty well. Usually, you know, the first few days they're really nervous and scared and they're just trying to get through it. But most patients are here from 5 to maybe even 30 treatments, and we become very friendly with them, very attached. We care about the patients quite a bit.
You know, making them feel as comfortable as we can, just talking to them, almost at the end becoming friends with them. We get to know them really well.
And we try and make this as easy a process for them as possible, because I'm sure that they've gone through a whole lot from the point they've been diagnosed up until we see them. So we want to make this one of the easier things that they have to go through during their whole complete treatment.
Make sure they're lined up properly, and then we come out here and we do our work out here. We use lasers, and we also have a surface monitoring camera that helps us align the patient properly. Once we do that, we come out here, we'll for most cases, we'll do a CT scan, and that helps us position, make sure we're right on target. Once we do that, machine rotates once, twice, and typically, you know, in and out within 10 minutes. Takes longer to make sure that we're on target than the actual treatment. Personally, you know, humor is the best medicine. Being in this field for close to 30 years, I picked that up through other therapists, and it does help, and you know, it kind of breaks the ice. I mean, you add humor to it, and it kind of, you know, eases the whole process. You know, the quality of care is same as a big center. It's very personal. It's like, I can talk to the patient. I have time to talk to the patients. Other centers, they're just walking in and the other one's already walking out, you know. So it's not a numbers game. It's one-on-one. By the time they walk out of here, they're almost like family.
Oncology social workers are licensed professionals who counsel people affected by cancer, providing emotional support and access to practical services. The social worker helps connect patients and their family members to all other components related to oncologic care and patient well-being, including individual counseling, navigating care resources and support groups, locating services that can help with in-home care or transportation, as well as guiding patients through the disability process or other forms of support, such as financial assistance. Usually you will be scheduled to meet the social worker during your consultation or simulation visit. Before you begin treatment, a clinical consultation and evaluation will be scheduled with the radiation oncologist, who will provide information and answer any questions you may have. On the day of your consultation, our receptionist will inform the nurse of your arrival and present any additional information you may have brought with you. You will be asked to complete several forms, which will provide your care team with better insight and understanding of your medical history so that we can optimize your care. The nurse will guide you to an exam room and ask about any medication you may be taking and other medical history and related questions. The physician will review records, body scans, and other test results and will perform a physical examination. Not all patients are appropriate candidates for radiation therapy. If the physician believes you are a candidate, you and your referring physician will receive a full explanation of their evaluation. If the physician believes that you will benefit from radiation therapy, a treatment plan will be recommended and presented. The physician will discuss your diagnosis and the recommended treatment with you and your family, including whether additional tests will be needed. The nurse will provide you with additional information and instructions and will arrange your next appointment. If your recommended treatment involves radiation, a treatment planning session will be necessary using a CT scanner, also referred to as a CT simulator. Further calculations are made involving the dosimetrist and physicist. They will determine the best method of delivering the exact dose of radiation, both external and internal, to the affected area.
A simulation is essential. We cannot do anything without that simulation. During the simulation, we're going to get the patient set up in the treatment position that we're going to use daily. The CT scan allows us to get the density of the different tissues, the lung, blood vessels, muscles, pancreas, all the organs, bones. So without that, we would just be guessing on how much radiation to give them every day, where to give it. So really nothing can happen until we do the simulation.
Once the simulation is complete, you will be given appointment options for your first treatment setup day. The amount of time between planning and setup day will depend on the complexity of the treatment plan. The physician, physicist, and dosimetrist will develop your individualized treatment plan using the images taken during the simulation process. They will calculate the appropriate dose of radiation required for each daily treatment, also called a fraction, and how to best protect healthy normal tissue. This preparation may take several days to complete. Radiation treatment is a multi-step process. For external beam radiation, the first setup appointment normally takes slightly longer than the regular daily treatments, which are approximately 20 to 30 minutes. This additional time ensures that what was planned during simulation is reproduced exactly. Confirmation X-rays are usually taken on this day, and your actual treatment begins the following day. During your first week of treatment, the radiation oncology nurse will discuss the self-care measures necessary for your comfort and safety during your treatment course. Please feel free to ask the nurse questions or request assistance anytime during your visit. Once your radiation treatment schedule is underway, you will arrive for treatment at the same time every day. The total amount of time you spend in our department is approximately 20 minutes, and the total radiation course may last from 1 to 9 weeks. Some treatments may require a single dose of radiation, such as intraoperative radiation therapy, IGRT, an outpatient procedure for breast cancer. Your physician will typically see you once a week during your course of treatment. This will usually fall on the same day each week. These physician visits are called on-treatment visits and generally require a little more time than your regular treatment days. Other forms of radiation treatment include brachytherapy, using either low dose rate LDR or high dose rate HDR techniques. Radiation is delivered internally using tiny implants that can either be temporary or permanently placed inside the affected tissue. These treatment methods give the radiation oncologist additional options for treating cancers and tumors. Superficial radiation therapy, SRT, is another low-energy outpatient radiation treatment used to treat cancer and other conditions on or near the skin surface. SRT can be used to treat basal cell carcinoma and squamous cell carcinoma and can be used on almost any part of the body. You may encounter side effects during your treatment, which should be brought to the attention of the nurse or radiation oncologist. It is essential that you use only medications or ointments that have been prescribed for you by the doctor. For example, special creams and dressings have been developed specifically for skin reactions from radiation treatment. If recommended, you will be given additional information and self-care instructions. If your treatment involves your head and neck area or the gastrointestinal tract, a nutritionist may become involved in your care. Similarly, if you wish to receive information for various support groups, the nurse or social worker can provide additional information. External beam therapy involves using high-powered X-rays to destroy cancer cells by disrupting their ability to reproduce. The goal is to isolate the treatment area while minimizing radiation to the normal surrounding tissues. The patient is positioned on the treatment table and may be secured with an immobilization device. This ensures the patient does not move during the brief time treatment delivery is active. Some structures within the body are very close together, making treatment planning and radiation delivery very challenging. The Varian Edge linear accelerator is highly advanced and designed explicitly for precision radiation therapy. With sub-millimeter accuracy, it can deliver radiation precisely while providing real-time tumor tracking. This allows the machine to adjust the radiation beam's shape and strength to account for tumor movement during treatment, such as with breathing. Intensity modulated radiation therapy, IMRT, allows the radiation dose to be shaped to the contours of the tumor, minimizing exposure to healthy tissue. This is achieved with the multi-leaf collimator, MLC, which is a computer-controlled device inside the head of the linear accelerator, made up of many closely spaced movable leaves that adjust independently to block parts of the beam. When active, the collimator moves organically, creating polygons that match the tumor's profile even as the machine rotates. Image-guided radiation therapy, IGRT, the standard of radiation treatment, involves taking high-quality images before each radiation therapy treatment session to increase the accuracy and precision of the radiation delivery. This ensures that any changes in the body or the tumor are accounted for. Such imaging allows for the visualization of tumors and surrounding structures immediately before and during the treatment, further ensuring targeting accuracy. Stereotactic radiosurgery, SRS, for example, delivers a high dose of radiation to small, well-defined tumors in a single dose or in just a few sessions, such as with treating pituitary tumors or brain metastases. The term radiosurgery is derived from this treatment method, which has such a dramatic reducing effect that the changes are considered surgical. SRS may be used as the primary treatment when a tumor is inaccessible by surgical means, or as a boost or adjunct to other treatments for a recurring or malignant tumor. Stereotactic body radiotherapy, SBRT, refers to a technique that treats tumors in the body outside the brain. With the capability of higher doses of radiation, treatment is completed over a few sessions compared to several weeks or more compared to conventional therapy. Volumetric Modulated Arc Therapy, VMAT, involves radiation delivery in a continuous 360-degree rotation around the patient, providing highly conformal dose distributions. This technique reduces treatment delivery time in as little as 10 minutes, which improves targeting, accuracy, and patient comfort. The Varian system also supports adaptive therapy, where treatment can be adjusted based on changes in the tumor size, shape, or its position over the course of treatment. As radiation is delivered, the tumor may move or begin to shrink over several weeks. The system is designed for that possibility, modifying radiation delivery according to these changes. Internal radiation or brachytherapy involves treatment near or inside the affected tissue. There are two types of brachytherapy: intracavity treatment and interstitial treatment. With intracavity treatment, the radioactive sources are put into a space near the tumor, such as the cervix, vagina, breast, or esophagus. Such is the case with ovoid radiation treatment, also known as tandem and ovoid brachytherapy. Radioactive material may be placed within a tube inside the body and removed when the prescribed dose has been reached. With interstitial treatment, radioactive sources are placed directly into the affected tissue, referred to low or high dose rate brachytherapy. These methods may come in the form of seeds, ribbons, or capsules based on the most optimal placement and treatment. Interstitial treatment may require anesthesia and a brief stay in the hospital. Patients with permanent implants may have fewer restrictions and quickly return to normal activities. Temporary implants, however, remain in the body for a period of time, minutes, hours, or days. During this time, patients stay in a private room until the implants are removed. While radiation delivery is present, doctors, nurses, and other medical staff remain on hand, but take special precautions to limit their exposure to the radiation. Intraoperative radiation therapy, IORT, is a form of internal radiotherapy that delivers a single dose of radiation after the tumor has been surgically removed. The goal of IORT is to deliver radiation to the treatment area only, minimizing exposure to healthy tissue and organs. IORT can be especially beneficial for cancers that are difficult to remove, such as breast, pancreatic, and brain cancer, glioblastoma. You have completed your radiation treatment, and your oncologist will continue to follow your progress closely. Patients are usually seen within a month following treatment. The nurse will continue to monitor and help you manage any treatment-related side effects, providing personalized care, instructions, and education, including referrals to other health specialists such as physical therapists, nutritionists, psycho-oncologists, or palliative care specialists, if applicable. To ensure your continued health, future follow-up visits will be scheduled every 3 to 6 months. The radiation oncologist will continue to work with your primary care physician and other specialists to ensure the best possible outcome.
So as you can see, we have a wonderful team that works very closely together to make sure that the radiation is delivered effectively and with compassion for every moment that our patients spend with us in the department and after they are finished with their treatment as well.
At Vasek Polak Radiation Oncology Department at Providence St. John's Health Center, we are here to support you through your entire cancer journey. Discover the difference our highly committed care team and the most advanced radiation treatment can have in the fight against cancer.